Tech Hub, for a smarter you.
Up next is a chat I had with Sebastian Obata, an AI expert who is also enthusiastic about data analytics. And in this interview, we talk about how experts are using data analytics to help tackle health crises, not just in Nigeria, but in Africa as a whole. You should listen to this conversation.
Thank you so much for joining us on this edition of Tech Hub. I call it your one-stop platform for all things tech in Africa. Now, for those of you who don't know Sebastian, he is Sebastian Obata, a data scientist at the University of Cambridge, and he is also an artificial intelligence expert and the founder of the Applied Artificial Intelligence Society. Speak of a Nigerian man who is doing absolutely awesome in tech on a global scale. My hands are for you. My hands are for you, Sebastian. Merry Christmas, and it's so great to be speaking with you on, I think, data analytics specifically for this particular edition. Great to meet with you, Sebastian.
Well, thank you so much for having me, and it's Merry Christmas, and it's a pleasure to be here.
Right. So I don't know, how does it feel for a tech expert like you, somebody who did crunching data, and somebody who is deep into artificial intelligence? How is Christmas like for you? Do you see Christmas the way the rest of us see Christmas?
Yes, I'm going to say it in two ways. Yes, so for me particularly, I see Christmas as a way of relaxing and reflecting, because during the year there are a whole lot of activities and projects that was done. So I see it as a part of relaxing. Then the second thought is just to actually see the reason why the Christmas was actually made into existence, and just to reflect on our personal life, family, relax with family and friends.
I totally like that. You guys are human after all.
True.
You're human after all, because we're thinking artificial intelligence, data, these guys are all computers, just with flesh and blood. But anyway, the nitty-gritty of the conversation today is about data analytics and how that can be used in tackling the health crisis, not just in Nigeria, but in Africa as a whole. And sometime earlier in the month, there was a hackathon, where people who are enthusiasts in the particular sector came together to see how they can use data analytics to, decipher issues and propose solutions. And we know how much Africa needs, huge solution in the health sector. So let me get your thoughts about how health was before tech, and how it is now during the tech, revolution in quote, especially when it comes to data and AI. So we do a comparison of past and present.
All right. So you see, globally, right, countries faces healthcare challenges, but it differs from one country to another. And you notice that these challenges are prevalent in countries that have high human development index. And of course, the main common issue is human resource, and attention has been given to it. But such attention, you see it in countries that have low human development index. Now, healthcare system in Africa over the years have suffered from man-made issues, which we could say is institutional, human resources, financial, technical, and political development or policies. Now, in the light of this, in 2007, World Health Organization proposed a framework that categorized this into 6 frameworks: service delivery, healthcare workforce, information system, medicine and technology, financing. But before technology, majority of the African countries were unable to meet the basic requirements or meet the basic building block, the 6 core components stipulated by World Health Organization. So in summary, the African health sector continues to struggle with lack of resources and funding. However, there is a bit of hope with the creative use of technology, which offers new possibilities for improving access to medical treatment. So if we x-ray the recent developments spurred by the pandemic, and you will see that health tech on the continent is actually in for explosive growth. So as you can see from new technologies such as drone apps, computer-controlled vending machines, and all helping to break down these barriers. Having established that in Africa, health systems are inefficient prior to technology, disruptions in medical equipment, drug supply chains, last-mile health systems, and medical data analysis and storages are just a few examples. But currently within technology, we have the effects of telemedicine, we have the drones, we have the African continent is actually utilizing the big data analytics, wearable information management, innovations, and all that. Let me just give you some of the landmarks that have been achieved within African health system. So you see that African health technology has grown rapidly. So in 2020 alone, more than 40 health tech startups on the continent received a Series A funding. Then another one is recently launched companies are involved in a variety of health-related fields, such as genetic sequencing. You can see that South Africa was on the top of the list of those during the COVID to identify a gene mutation of the COVID virus. So in May, the South African National Blood System announces that they will begin using drones to transport blood in order to combat the continent's high maternity mortality rates during childbirth. There is a whole lot of impact. Or should we talk about the remote care system that we are getting? While we understand that infrastructure can be poor, the number of mobile internet users in sub-Saharan Africa is gradually growing. The reason why I'm focusing on sub-Saharan Africa because we have 613 million projected unique mobile subscribers in by 2025, and this covers 50% of that population. And you will see that this projected number is required to deliver 154 billion US dollars in economic value by 2025.
These are absolutely great examples that you've pulled, and really it sounds pretty optimistic for every African. Even for people who are out of Africa listening to you right now would think, my goodness, I mean, the impact on the health sector is absolutely amazing. But people in Africa will tell you, I mean, people are still dying. People don't have access to, high quality medical attention when they need. Brain drain is happening, which we're even going to talk about later in the day. And I like the fact that we've got some of these health startups, right, has got series of fundings. Beautiful, absolutely amazing. And that is one step in the right direction towards bringing about, a solution to the health crisis in Nigeria. Another way is finding talents, right, who can actually brainstorm, talk about the ideas that they have, and hopefully get the attention of the people who can fund them towards bringing the solution, which is what brings me to a hackathon that was held sometime earlier this month, where data analytics, was used as a method to helping to find solution to this health crisis. And thankfully, you were one of the judges at that particular, event. How was it like, and what was the hackathon aiming to achieve?
The hackathon was organized by 10 Analytics and Mustard Seed Insight, and this began in 2021 with a mission to build a community of Africans across the globe where data analysts, data scientists, researchers can come and showcase their skills, but above all, provide solutions to the problems faced in Africa. Now, this year marks the third edition of the Data Analytic Hackathon, and it kicked off on the 3rd of December 2022. And we have close to 2,000 participants across the world. And again, Mustard Seed collaborated with them in putting this together. But here I was a judge. I was one of the panel of judges in this year's hackathon. Now, the aim or what it tries to achieve, because one, it remains the undisputed biggest hackathon in Africa, and the mission of this year's edition is to tackle the healthcare crisis that are faced in Africa.
Very interesting, Sebastian. So when you tell me that you want to use, I'm being a layman on the street right now, you want to use data analytics to solve health crisis. I mean, how does that work? Because I don't know, it sounds like big grammar to me. How does that work?
So we are in an era of data, and you hear so many people tell you that data is the new oil, data is the newest thing on board. But that's the truth, because without data, it's just another piece of opinion or a person giving on his own opinion. Now, in the world that we are, it's undisputed that data is actually giving insight to great and bringing forth great innovations. And that's what gives birth to the birth of AI, gives birth to the birth of so many technologies that we are seeing today in the world. Now, within the health sector in Africa, can I say that, that we don't have enough data, or we have enough data, but again, we don't have enough, we don't know how to bring this data together, derive insights from it, and generate the insights. So some of the companies or some of the world systems that are progressing heavily on health health systems are actually leveraging on the data within them and trying to develop more of the analytics that is needed in order to improve lives and the well-being of their citizens. So data is currently a key thing in generating these insights.
This is absolutely fantastic. So, I mean, what was your experience as a judge?
To be honest, I was super excited because we have close to 2,000 participants across the world. And Nigerian came first, and not just a Nigerian, a lady for that matter, came first in the competition. So for me, I was inspired. Yeah, I was inspired and excited to see it. I mean, we also have African countries. I think one of the African, is it Ghana? Someone from Ghana came third and all that, showing the giant strides that Africans are making, but specifically Nigerians. First, I would like to borrow the words of W. Edward that says that without data, it's just another person with an opinion. But above all, I was intrigued with all the presenters, with all the proposed solutions, because the data that we're given were real data from World Health Organization in order to derive this insight. And I was intrigued to see how these people were able to transform and derive intelligence. First is intelligence, and this is why I keep telling data scientists, before you build any model or anything, the intelligence that is embedded in that data is first what needs to be presented. And I was super excited to see it. And coming from Nigerians again, I was more than glad.
Let's finalize with your recommendations on the use of data in Nigeria.
If we want to build and strengthen the ecosystem through data, or more especially improving our health information system, then we need to start leveraging on data. We need to start doing the things that have been talked about. Different conferences, different people have been, but nobody do anything. I mean, yes, we have a general pool of system. We have BVM, we have NIM, we have this, we have that. That can actually be used in the electoral process that is coming up in next year. Do we actually need to start doing PVC? That we can use that system in order to replicate it and generate PVC rather than people queuing on the queue to collect this. So we need to start doing things and stop talking. And it's not peculiar to Nigeria as well, across Africa. Then I've seen, for example, let me talk about healthcare because I'm so passionate about it. So I've seen Nigerian Health Information Intervention Policy and Framework. Wow, I can tell you that it is not robust enough. There's no feedback mechanism. There's no across all levels. And when you compare it side by side with other African nations, you can still spot some similarities, but compare it with other European countries, you now see that this is a whole lot of robust system where their data platforms, gathering of data. Of course, I don't even think that if an average Nigerian drops on the street, that we can have accurate record of that person in order to match it on the database to identify the blood, to identify who can donate blood, and all of this. So we need to start, first of all, build a data warehouse, build the data records that we have, because they are all sitting in different silos. Can we merge them together for meaningful purpose or meaningful use? So let's stop talking and start doing and implementing, because every Nigerian knows the problem. Few have the solutions, but no one is implementing it.
Fantastic, Sebastian. Fantastic. Thank you so much for this few minutes of conversation. It's been pretty eye-opening for every one of us. Sebastian Obata, data analytics, as well as an artificial intelligence expert. Thank you so much for joining us on this conversation. We're going to be having more of you because we need such intelligence conversations that can help support the people, inspire the people, motivate the people, to begin to be innovative, and also to hold the government accountable to, stop talking and start doing, like you said. Thank you so much for joining us, Sebastian.
It's a pleasure.
On Tech Hub, we help you understand how tech can impact your life.
Your phone and your SIM card is going to be a bigger asset.
And with the power that we have with social media, with the digital space right now, you can be anything you want to be.
Tech Hub, for a smarter you.